Hello, my name is Jennifer Connor-Godby, and I'm a licensed clinical social worker here in the Department of Psychiatry at University of Kentucky. Today I want to tell you about an evidence-based, well-established treatment option for youth and families who are suffering the ill effects of substance abuse and related issues. Despite having branched out all over the states and internationally, it's a relatively new program to Kentucky, and I and several of my colleagues here in the department have been learning and practicing functional family therapy. FFT has been proven in numerous settings to be effective for the treatment of youth with a range of risky behaviors, things like criminal activity, out-of-control behaviors at home or at school, violence, substance abuse, and others. Through the Kids Recovery Grant, we've had the opportunity to get certified in this treatment protocol so that it will be offered here permanently. The treatment is open to youth and families who are concerned about a new or existing substance abuse and or other problem behaviors in adolescence. Myself personally, having worked with teens in trouble for the past 13 years, I know the difficulties that many families and institutions face in trying to find help that works. I've found that this treatment approach offers a viable alternative to more intensive or long-term individual treatment options. For example, one family I'm working with right now has been in outpatient therapy and psychiatric care for about a decade with their son. And this is the first time that the parents report that they are involved in the treatment working on their own part, which is a subtle but important difference that makes FFT unique and separate from previous approaches that may be focused more on teaching parents skills that might help them parent their adolescent differently. This family, for example, has been successful in changing a pattern of interacting that's made working together much more feasible. In general, FFT focuses on removing blame and negativity and replacing that with an alliance between all family members and the therapist to identify and implement new skills that work for them to accomplish their common goals. As you can imagine, it's not uncommon that everybody in a family wants for an adolescent to become independent and self-sufficient, and they all have different ideas of getting there. Perhaps anger, blame, and the hurt it has caused have kept them from working together. Using FFT and learning conflict management skills and problem solving in ways that fit each family's unique values, culture, and style makes working together possible. The primary distinction that sets this approach apart is the focus on the family. Everyone participates in each session after the initial interview, and most interventions last for about 12 to 16 sessions once per week. First phase is focusing on understanding problems and issues and patterns that have the youth and family stuck and getting motivated to make the changes. Then we identify specific behaviors to target in the pattern that's going on. We learn the skills and tailor them exactly to your particular family and work on changing those patterns and things that are getting in the way. Everyone in the family learns something new they can do differently to help in the second phase, and then we work on generalizing those skills to other settings, the community, the school, where interactions with peers and other things that people are concerned about. It's been a really good fit for me, and if you or a family you know is suffering with some of these issues, check out our website for more information to find out more about our clinic and about functional family therapy.